Your story is so powerful. And I remember in 2006 when myself and Lisa Gibbons wrote the book with Dr. Rosemary Laird, Take Your Oxygen First.
Yes.
It was for family caregivers dealing with neurological disorders, but it's very similar to screenings because we wanted people to get screened for memory, for disorders, Alzheimer's, Parkinson's, Lewy body. But it turned out that when they went, their worst fears were never realized. They may have been depressed, and cognitively, they found out they were depressed. So the unknown was scary. But when I went to them, and I think this is what you're pointing out for us, is that to take your oxygen first sometimes is tough. Having self-love in the moment and calling for the screening is difficult sometimes. It's a process, right? But when you think about your family, your kids, your husband, your dog, all of a sudden now, taking your oxygen first may be the best thing you could possibly do, which is the screening. Mm-hmm. Getting screened is actually taking your oxygen first. Now, if you can't feel you can do it for yourself, then look at you, look at your family. Look how many patients you're serving now in the Sebastian area by doing what you did, by taking your oxygen, by getting screened. Look at the powerful work that you've done over the many years that you've been a survivor.
And I think too, when I think about that, I have patients who won't go for screenings. If you have a friend or someone that you know that maybe hasn't had a mammogram and you have, sharing your experience. I did this, it was fine, let's go, I'll go with you, let's get coffee after, we'll go to the beach, we'll go for a walk, and help that person, go through that experience. For me, it's been that sharing part that really, I think, has maybe even pushed some people to see, wow, she did okay, and if I'm that scared that something might show up, I might do okay too.
Genetically, if there's a predisposition for breast cancer in a family, at what age should somebody really look at it? And if there's not a genetic predisposition, at what age possibly should somebody look at screening? Or is screening something that should always be done, doctor? You tell me.
Current recommendations are really to start at 40. If you have a breast cancer in your family, your mother, grandmother, potentially siblings, absolutely, then yes, going earlier, even starting at the age of 25 or 18, just depending upon the real schematics of it, I suppose. But really the age of 40 should be the first mammogram. And then, could you go every 2 years at that point? You could. With the every other year recommendation of mammograms that came out several years ago, I've always continued to give that recommendation of going every year. 12 months can turn into 14 months very easily. And so why not give them the recommendation of every year? I also still recommend self-surveillance. Why not be aware of your body and what's happening? That was the way that I was diagnosed. I knew something was wrong. I didn't pay attention to it for a while, and so my experience was a bit different. If I would have paid attention to what was happening with me, if I was quiet, if I would have breathed maybe for an extra second, I would have perhaps gone a little bit earlier. But I think, so at the age of 40, I guess to answer your question, earlier if needed, as young as 18 or 20 depending. If you have a lesion that you're feeling, do you need a mammogram or an ultrasound or some other type of diagnostic study to be performed?
When you needed a breast screening, as you mentioned, were you afraid before you went?
I was afraid. I was very busy. I was very consumed. So my diagnosis was a little bit different. I actually did not have a mammogram initially because I did have a quite large mass. And so it was a different situation for me at the beginning. Since that time, I have had so many of my friends, at a younger age and even, a little bit older, just really encouraging them to go for their mammogram. We've diagnosed so many people early. My situation was a bit more dramatic because I did wait, which was my own issue. I wasn't practicing self-love. I was, in a sense, practicing self-determination, but wasn't taking care of myself. Thankfully, I was quite healthy, and I think that's something important to talk about as well. The more healthy you are, if you do have some type of traumatic medical situation that occurs, hopefully you prevent it, but if you do have it, you can get through it, hopefully a little bit better.
So we use the word fear often, and I do with my clients, and the acronym for fear is false evidence appearing real. So when we wake up and have this tremendous fear, we don't really know that the unknown is our friend. We see it as our enemy. So you saw something that was extraordinarily difficult, which was a mass, But when our patients come in to see you, what are their fears?
So the one story I like to use is a lady who I have taken care of and still take care of, her and her husband, just really amazing, lovely people. And I think she was probably, let's say 67, 68 when she came to the office for the first time, talk about everything, preventative measures, colonoscopy, colon cancer screening. We do skin exams and some skin cancer screenings, and please get your mammogram. Oh, okay, I will. And she didn't. And I think it was definitely more than 5 years that at least once a year, if not many times, although she's very healthy and I see her probably twice a year at the very most, at the age of 75, or maybe just before her birthday, she said, I am going to do this for you, Dr. Winchell. I'm going to finally get that mammogram. This young, beautiful, awesome, healthy woman was diagnosed with breast cancer at that mammogram. And so it was early, thank goodness. She actually ended up having a spot in each breast and had a bilateral mastectomy, and to this day is doing really well.
So I'm asking, actually, anybody watching or listening to this, what is your why? And I'm going to ask you, what is your why? What would be the why that you go back to today that would make you grateful for getting screened and getting treated?
So today, it's really giving that awareness of please get screened, and the earlier the better. So if we put it off, I go back to the story that I shared earlier. Thankfully, my patient who wanted to give me that present at the age of 74 for her, last year of I'm going to bother her about getting a mammogram, anymore past the age of 75, which I do continue to encourage patients after the age of 75 to get mammograms. The earlier you go, the quicker you'll be diagnosed potentially, hopefully not, but that fear has to be then turned into perhaps a positive of if I go now and I'm diagnosed early, the treatment will be so much easier. I'll have such a, less painful experience. I won't have to have as much of a surgery, or I won't have to have chemotherapy, or I won't have to have radiation. The experience will be less painful potentially. So going early will be a better thing.
Screening is about education. Immediately we're going to be educated as to what we need to do now and after. Once we're educated, we're empowered, right? We're empowered to do something, right? And once we get on that journey of empowerment, we get energized.
Yes, definitely.
Right? Mm-hmm. So how did you kind of become energized, even though you kind of got news that wasn't comforting, that you didn't want to get? How today do you look at yourself in terms of the education, empowerment, and energy paradigm?
When I needed somebody to cover my shift because I wasn't feeling good, of course I reached out for help, right? And I had always people that were there to support me. Very rare instances where I had to call a second person. I think that becomes the part of the empowerment when you realize that you can reach out and talk to people. If it's not one, it's another. I do have a lot of patients that don't have what we would consider enough support. They sometimes don't even have two people. Maybe sometimes they just have one person, but it's always reaching out, going to your doctor's office. I have patients that speak to our medical assistants that they will share with the medical assistant something that they might not have shared with me because they feel more comfortable, perhaps. Maybe they connect with them in a different way. And so it's always making sure that you reach out, ask for help, and then understand that there are going to be people that will help you. You just have to keep asking. So when we go through these very difficult moments of, do I want to go at all? What's going to happen to me? And if it happens, what's my experience going to be like? We have to start somewhere, and it's that first step that, is the most important. I know when I'm having a difficult day, which is frequent, sadly, it's a hard job that we have. But even if I'm having difficulties at home or, a stressful situation that's outside of my work and I have to go to work and I think, how am I going to do this? How am I going to be helpful to people? How am I going to be calm and listen and empathetic? Sometimes what happens is that you help another person in your pain and suffering mind, and suddenly my pain, my suffering, my drama, my excitement, my, tense, nervous energy becomes calmer because I know that I'm helping someone else. And I think when you can offer that experience, opportunity, support to someone else, if you know your friends aren't going for breast cancer screenings, please encourage them. We talk about that a lot now with depression.
Yes.
That's something that, you see the commercials, it's really, I can't remember what it is, but it's something like ask the questions and then ask again, or something to that effect. Like, you really have to encourage really strongly in order for these people to sometimes make that step in supporting them.